As Cecily mentioned, my name is Beth Walsh, and I work for NAMI Virginia as the Adult and Family Services Programs Assistant and Helpline Coordinator. I was asked to stand up here today and speak on behalf of NAMI Virginia and on the National Minority Mental Health Awareness Month because, like Cecily mentioned, it is a month sponsored by NAMI. A little background on NAMI for those of you who might not know. NAMI, short for the National Alliance on Mental Illness, is one of the largest grassroots organizations in the country. It began in the 1970s around a kitchen table by these parents who were tired of being blamed for their adult child's mental illness. They said enough is enough, we're going to band together, we're going to have our voices heard, and we are not going to stop until we make the changes necessary to ensure a better life for our loved one and also getting the self-care that we need for ourselves. So through that fateful meeting, NAMI was created. And from there, affiliates spread out throughout the country, and from those affiliates were state organizations. So NAMI Virginia was created in 1985. We currently support 25 affiliates who play a role at the community level. Our mission is to promote recovery and improve the quality of lives of all Virginians living with serious mental illness through support, education, and advocacy. We offer educational programs, support groups, community presentations, we have a helpline, and we advocate on behalf of Virginians on the General Assembly level. The programs are my specialty, so I could sit up here and talk about programs all day long until I get blue in the face, but I'm not here to talk about programs, I'm here to talk about the National Minority Mental Health Awareness Month, and more importantly about Bebe Moore Campbell, why she's why we are all here today. Bebe Moore Campbell was an accomplished author, advocate, and co-founder of NAMI Urban Los Angeles, and a national spokesperson. She was part of the NAMI family, and I say family because once you are a member of NAMI, we are all one family. We all are impacted in some way, shape, or form by mental illness. So throughout her career as an author and journalist, she wrote numerous articles and books, but in September 2003, she published a children's book called Sometimes Mommy Gets Angry. It's about a young girl who's learning to cope with the bipolar disorder, her mother's bipolar disorder. So this book came from inspiration from her family. Bebe is a family member of a loved one living with a mental illness. So from there, she was awarded NAMI's 2003 Outstanding Media Award for Literature, and she wrote another book entitled 72-Hour Hold, which focused on an adult daughter and her family. These works help to educate Americans that the struggle often is not just with mental illness, but with the healthcare system. And as an African American, Bebe was seeing these struggles within her own community and became an advocate for mental health and education and support among the diverse populations. So from 2005 to 2008, Bebe spent her time working on creating a month dedicated to eliminating stigma and providing mental health information in these communities. Unfortunately, she lost her battle to cancer before she could see this dream become a realization, but hopefully she's looking down and saying, oh, yay. So after her death, her closest friends continued the work. So in 2008, with the support of Representatives Albert Wynn and Diane Watson, the bill was passed, and the House of Representatives declared July Bebe Moore Campbell National Minority Mental Health Awareness Month in recognition that improved access to mental health treatment and services and public awareness of mental illness are of paramount importance, and an appropriate month should be recognized to enhance public awareness of mental illness and mental illness among minorities. Whew. So that is why we are here today. She had a dream, and she stood by nothing, and nothing stopped her, and she just kept going until she could see the light in the tunnel, and this is why we are here. So again, why is this month important? I get that question asked a lot. For starters, 1 in 4 Americans are diagnosed with a mental health disorder, and mental health does not discriminate, as we all know. It doesn't discriminate against race, gender, social and economic standing, age. It can hit anywhere, it can hit any time. Bebe Moore was one of our family members who knew this. And we also know that African Americans in the United States are less likely to receive accurate diagnoses than their Caucasian counterparts. Schizophrenia, for instance, has been shown to be overdiagnosed in the African American population. Cultural biases against mental health professionals and healthcare professionals in general prevent many African Americans from accessing care due to prior experiences or history of misdiagnosis or inadequate treatment. And only 2% of psychiatrists, 2% of psychologists, and 4% of social workers in the United States are African American. The American Indian and Alaska Native population reports higher rates of frequent distress than the general population. Suicide is the 5th leading cause of death among Asian Americans compared to the 9th leading cause of death for non-Hispanic white Americans. Latinos are identified as a high-risk group for depression, anxiety, and substance abuse. I could keep going on and on and on. But these facts are why Bebe worked to create this month and why NAMI works to break down the cultural barriers and create support and education for everyone, and I mean everyone affected by mental illness. We are taking steps to create programs and showcase diversity within the mental health community. Through research, we found that Latin Americans and African Americans are more likely to seek help and counsel from their church or religious group rather than a medical professional. So from that information, we've created some faith-based programs that are helping to educate church groups. We also have what's called Sharing Hope. Now we're getting into the programs, which is what I like to talk about. So Sharing Hope is a educational presentation for the African American community that helps to decrease the stigma and introduce the programs and support groups available to them. And a lot of times Sharing Hope is actually a program that is presented within a church setting. So it kind of combines the two ideas. And of course, the Department of Behavioral Health and Developmental Services has also taken great strides to ensure that all Virginians receive the quality of care that they deserve. And one of these strides is why we're here, the Media Awards, which I am so excited to be here today to see the videos and to see all of your hard work. As the person who answers, I'm also the helpline coordinator, I don't know if I mentioned that. So I get a lot of calls all day long, about 6 or 7 a day. And there are people online who are experiencing firsthand the loneliness, the isolation, the confusion, all of these emotions that are felt when you are experiencing a mental health crisis. And so I thank you for your work and helping to reach people in the community who are feeling these emotions and don't know where to turn. This is what the month is all about, and we want everyone to receive support, to feel that they're not alone, and to receive the care to help them have the most amazing life possible. So on that note, I'm going to end it with some words from Bebe. Even though she can't be with us today, she has a wonderful quote that I will end with. So, once my loved one accepted the diagnosis, healing began for the entire family, but it took too long. It took years. Can't we as a nation begin to speed up that process? We need a national campaign to destigmatize mental illness, especially when targeted toward African Americans. The message must go on billboards and in radio and TV public service announcements. It must be preached from pulpits and discussed in community forums. It's not shameful to have a mental illness. Get treatment.